This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
We take care of probably too many patients in the emergency department with elevated blood pressure. A lot of people get referred in from outpatient surgery center, or they check their blood pressure at home and they know it's a little high and they come in. I don't think anybody loves taking care of these patients here in the ED, and there's always questions as to what do we do with their blood pressure? How aggressively do we treat it? Patients are freaking out about it. So there was a recent policy paper by the American Heart Association about treating or managing elevated blood pressure in the acute setting. And it had a couple important things. And, one of the things that was really nice, it got rid of the term hypertensive urgency. I don't know if everybody remembers that term, but it was a very useless term. And basically what the policy paper talks about is that there's hypertensive emergencies, which are things like aortic dissection and subarachnoid hemorrhage and really sick people with high blood pressure who need to be treated aggressively with IV medications. And then at the other end of the spectrum are people with asymptomatic elevated blood pressure, which is most of what we're taking care of. And this statement, the policy paper, says that there is really no benefit and there are harms to treating these patients urgently in the emergency department. You definitely shouldn't treat them with IV medications, and most of the time they don't need their blood pressure treated at all. What they need is kind of reassurance, telling them that they need to get their blood pressure managed as an outpatient, and that what they need to do is follow up with their PCP. So this is kind of what I like to do, and now there's a very strong policy paper from a very large organization that really discourages treating asymptomatic elevated blood pressure aggressively, just kind of strongly encouraging patients to get good outpatient follow-up and reassuring them.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.